Hi, I'm Julie Tao, and I reside. I'm a citizen of the United States. I had gastric bypass surgery 14 years ago and lost 150 pounds quite quickly. One of the things I never thought about going into the gastric bypass surgery was the fact that I would be left with a lot of loose skin, and it came as a surprise to me. And financially, it was something that there were no options open to me. So for the last 12 to 14 years, it is something that I have lived with every day. I hated it. I felt very trapped by it. It hangs. It gets in the way of clothing, any type of exercise. It's really a very trapped feeling. With the encouragement of friends who said, you know, do it. Save the money and get this surgery, get the skin removed and have a life. I started looking in the United States, knowing that it would be easier not to travel, and it became cost prohibitive. I also, out of the dozens and dozens of letters I wrote to physicians in the United States, did not have any of them personally respond back to me. And then the next country on my list was India, and I started searching and writing to the list of all of the different plastic surgeons that possibly could help in India, and Dr. Pavan Murdeshwar was among those. And I shared very briefly, and I don't think it was more than a day, I received a personal letter from Dr. Murdeshwar, and Dr. Murdeshwar said he wanted to help me. Dr. Murdeshwar, besides being an incredibly skilled physician who has, in the span of 6 weeks, performed 2 separate surgeries that involved multiple procedures, some of which these procedures normally are done 4 to 6 weeks apart. And he combined these surgeries very carefully and very thoughtfully. He worked with a partner, Dr. Abhishek, who the two of them together just are dynamos and are always very encouraging. Brilliant decisions made, like removing the umbilicus and the stalk, with great forethought into the fact that it was very long because I'd been very heavy, and it removed a tremendous amount of pain. He has a great plan for giving me a brand new belly button when I return. Yeah. And so many decisions that were made, the progression and when to take stitches out and what types of ointments to use, all have been brilliantly done. So skill-wise, there's no question. He has my full confidence, and I can't recommend him more highly.
First surgery we completed within a short time, which included the circumferential lipectomy as well as the bilateral medial thigh lift, and this included the fluid release procedure as well. And the second surgery, which was planned just 3 weeks after the first major surgery, that included the bilateral breast lift as well as the arms lift, which is also known as the brachoplasty. So in the interval in between, she also underwent a few Botox injections for the face lift, and all these procedures she handled it very well, and her body was very much efficient to recover as soon as possible. And once all these procedures are recovered well, now she is fit and fine to return back to her home with a body which is completely different from what she had earlier.
One of the great things about working with Dr. Murdeshwar is that he has a great working collaboration affiliation with Motherhood Hospital. So the surgeries I received were here at Motherhood Hospital, where many of the plastic surgeons I wrote to don't have that working relationship with the hospital, and the surgeries would be done in their clinic. And those are big surgeries to have done in a clinic. The nursing care here is stellar. The care, the bedside care of the nurses, you're never in want of someone to be at your bedside. I have worked in hospitals in the United States, and I can tell you that motherhood is certainly up to standards with safety, with cleanliness, with care, with safe practices. So very, very pleased, very good experience.